This is your fortnightly instalment where I interview a trailblazing physiotherapist that has shaped the profession we are today. In celebrating their journey, knowledge and insights, you gain the opportunity to plan and guide your own professional journey. My name is Doug Carey and welcome to Physio+10. Welcome new and previous listeners to Physio+10. Thanks for joining us again. Our special guest for today's conversation is with Chris Perrey. Welcome, Chris.
Thank you.
Look, we start these off by asking the guests just to give us a bit of a background about sort of where they grew up and what your early schooling was.
Well, I grew up in England, so New Zealand born, but grew up in sort of a little bit in Australia and mainly in England. Not too educated parents, so both of my parents, I think, finished school at 15, but were very supportive of my schooling. And then I actually did genetics as a first degree at university in the UK. And then I worked in research for 12 years after that. And so I came into physio quite late. So I moved to Australia in 2007. So I was 35, 36 at that point. And did physio as a second career, basically. So I did the graduate entry masters at Curtin.
Now, before I didn't know any of that, so I just want to unpack that a little bit. Why did you do genetics?
I mean, you come out of college in the UK at age 17, 18, and I didn't know what I wanted to do. I started off doing medicinal chemistry, which only lasted 2 weeks. It was definitely not for me. And so I had to look for something else, basically. And genetics seemed quite sort of, it was one of these up and coming things. It was quite sexy. The course was great, just what I wanted, basically. And so it wasn't that I necessarily felt like I wanted to work in it. It just kind of seemed like a good course. And then I just fell into jobs after that and fell into research.
And like in the family structure, you said mum and dad, neither of them went to uni. So obviously none of them were in the health industry. What were your parents doing?
Mum was really a homemaker. Dad lived in Australia at that point. So he moved to Australia when I was about 15 maybe, and just had, random jobs, supervising cleaners, cleaning businesses, that sort of stuff. So
yeah. And were you an only child or did you have siblings?
No, I've got a brother as well. So my brother finished school at 16 and did a couple of years just in an art college, basically. So like a vocational qualification, and I didn't really use that as a job, but.
Okay. So really in your family, you were that first person that went on to university and then
pretty much, yeah.
Also the first into the health field as well.
Exactly, yeah.
Now, again, you had your first career in genetics, and then what was the momentum for you to move to Australia?
Basically, I was starting to go up the rungs a little bit in genetics, and so I'd done a lot of research, got a lot of good papers out of it, which was nice. But you start to then get into management, which I didn't really want to do, and I definitely didn't want to do that for the next 30 years. And so it was really a crossroads moment of I've got to either stick this out for the rest of my career or I've got to go and do something else. And so the decision was, let's look at Australia. Let's see what's out there. And at the time, I was seeing a couple of physios from New Zealand who were the best I'd ever seen. They were brilliant. And so they sort of encouraged me strongly of, if you want to do physio and you want to be good at it, you need to move to Australia and you need to do one of X, Y, or Z courses. And that's going to fast track you along, basically. And so everything seemed to come together, and that's what pushed me into Australia.
Right. So hence the graduate entry masters program. And
yeah.
Okay.
I actually started in the undergrad program because there was a couple of things I didn't really have experience of. So my anatomy wasn't quite good enough. And so I didn't feel like I could apply straight into the graduate entry. And so I actually did a year of undergrad, and knowing that I was probably going to transfer into the GEM program at the end of that first year.
Yeah. Okay. So how did you find the university experience the second time round? Like, I'm not UK, Australia, undergrad,
Yeah,
graduate
yeah.
entry
So
master. How'd that go?
the first year of undergrad was a bit frustrating because you're learning with 17-year-olds. And I remember what I was like as a 17-year-old, and it's just about finding your feet as an independent person, learning how to study, and so my first year was a little bit frustrating, and I was also doing things that I could have done in my sleep. Had to do biology units, which were way below where my level was.
Yeah.
But then once I transferred into the gym, it was great. I was learning with people that had left their own lives and given up things, paid money to come from Canada or Korea over to Australia and study. So I felt like I really fitted in at that point.
And how important, like, that's an interesting thing for people to consider, because I noticed that, I was a 17-year-old, actually I was a young 17-year-old going to undergraduate as well. And certainly when we came to our second year, we had this influx of 7 or 8 phys editors that were coming back to do physiotherapy.
Mm-hmm.
They raised the tone, like they raised the expectation level of us little kids, so to speak, in what was expected of the lecturers, and the whole standard just raised up. And they were serious, like they were here to get this job done.
Yeah.
And in that way, they almost layered a level of professionalism over our course, which was interesting to see happen in front of us.
Yeah, I agree, and I saw that from the other side as well. So I know the gems generally weren't really well liked in the physio realm from other students, because I think you're right. There's a bit of challenge there, and we were there to get a job done, study hard, and it's not about anyone else. It's about what we did.
Yeah, you bring that adult perspective to perhaps a bunch of young kids, really, in a way.
Yeah.
Which is what we all did it. We're all there at some point in time, and we all enjoyed it too. So hitting the gym program, you felt like you really hit your straps, and it was the environment for you and suited you really nicely. What were some of the experiences? Because it's a pretty intense program as well, isn't it?
Yeah, it's really intense, and so you become quite close to your classmates, because you're all going through this. It's almost like trauma. So, it's hard. It's like the undergrads get a year to do 4 placements or 5 placements, and you're basically doing one after the other. So you do 4 weeks, and then you have the weekend, and then you start your next placement. And so that's really tough. So rather than doing that year of practical work, you do it in 3 months. So it's full on, and so you definitely feel very downtrodden and bereft at the end of it. And so having those classmates around was great, actually. I still have really good friends from that course as well, because you prop each other along, basically.
Yeah. Was there any moment there in that gym program where you thought, this is just too much? I really have bitten off too much and I'm sort of choking rather than chewing?
No, not at all. No, I actually really enjoyed it. It was the first time around I studied because I had to and needed to get a degree out of it, but I did physio because I wanted to be a physiotherapist, and never felt like it was too much or I didn't want to do it. I actually enjoyed the study.
Yeah. Okay. So look, you graduate from your gym program. How was that different to you, say, than when you graduated from your science genetics program?
I think I just knew what I wanted to do, and it wasn't just about study. It was about all the other stuff I'd done, the sports stuff, etc. I'd done during my whole course as well. So I knew exactly what I wanted to do at the end of the physio course, and I wanted to hit the ground running, because I was 39, 38, 39 when I graduated, and so like I couldn't wait around for 10 years learning my trade. I had to really get stuck into it, basically.
Yeah. So how did those next couple of years develop? And I'm particularly interested to know also how ruthless you were in the decisions that you made with regards to fast tracking your profession or your progression, I guess.
Yeah, I mean, I worked hard. I worked hard not just at uni, but I worked hard outside of uni. So I did a lot of sports stuff. So like basically the week I started undergrad, I started with a rugby team. And so I was doing all Saturday, 2 days a week, and then basically I was taking every sports job that I possibly could outside of uni. And so when I graduated, I'd lined up, I think, 4 job offers with private clinics. And because I'd done a lot of extra stuff and I was a little bit older, I sort of had my pick. And none of them were really right for me. They weren't the right fit. And so I actually ended up taking the first job as a 3-month contract in a stroke rehab ward at Fremantle.
So that was a, like, I hear sports, and then for undergraduate and gym, and then all of a sudden you're saying none of the jobs are right. You're going to a stroke rehab unit.
It was a real shock actually to me, because I thought the same thing. I mean, I got into physio to do sports, and then my last prac before I finished was in neuro stroke rehab, basically. And it's great. You get to test your reasoning every day with it, and you get to try different things that are completely applicable to normal everyday people as well. So when I left that practicum, they sort of said, if you're ever looking for a job, let us know. And so I did. The jobs that had come up weren't really me. It was the chain clinics that offered a PD program that I didn't really feel that I needed. felt like I needed something a little bit more bespoke. And the place that I wanted to work at, which was Ascend Physio, that's where I always wanted to go, and there was no vacancies there. So I took the stroke job instead, which I loved, and probably would have stayed there if I could have just stayed in that ward. And then towards the end of that, a job came up at Ascend, so it was almost just meant to be. So that was my next journey.
So you almost became a neurophysio.
Exactly.
It's amazing how things can pivot, based upon one decision or happening one way or the other way.
Yeah.
So you start at Ascend. I guess you're nearly 40 now. You sort of feel that there's a bit of a time pressure on you. What was it you were seeking from that particular clinic, or what attracted you as a new grad to that type of clinic?
I think I wanted to be around an active and a sporting population, and people that wanted to get better and were going to be integrated into their own health and rehab, rather than someone that just wanted some passive care. And so that was really attractive for me. And Ascend obviously had a really good reputation at the time or still does, of rehab-based therapy. And just the people around me as well were what I was looking for in terms of my own development. So I needed people that I could, I had a difficult case or I didn't know something, I could go and talk to them, rather than I didn't need to know how to do an ACL rehab, because I can do that in my own time, or I can talk to another physio about that. I didn't feel like I needed guiding through that quite so much. So that was that more like bespoke development, I guess.
So that's one thing that's a bit confusing, I think, for some people, is that you're a mature age student, you've got all those soft skills down pat as far as communication and understanding and situational awareness and those types of things, but your clinical skills aren't, on par, I guess, with those soft skills.
Yeah.
What were you looking for when you say mentorship at that stage? What did you really value?
It was probably just the opportunity to talk to somebody. So I have this patient with this, I've never seen it before, or I don't know how to rehab it. Can you, here are my ideas. What do you think? So it was just that opportunity to connect with somebody rather than being told something.
Yeah. Yeah. Okay. Yeah. And like, how long were you there for? And is it around about now that you decided to put the foot down again and go back to Curtin?
I did. So I actually stayed at Ascend until I moved to Canada in 2018. So I was there for 8 years. And so I basically went into my postgrad as soon as I could, as soon as they'd let me, basically. So
I'm back again.
Yeah, hello, it's me again. So I started in 2012 and did my musculoskeletal clinical masters. So over 2 years part-time. So it meant I could still work. Still had all of my sports commitments. So I was still working with teams at that point. Plus, I was probably doing 60 to 70 hours a week, maybe. I was doing my part-time MSK Sports Ascend.
And how are you physically handling all this, like physical, mental?
Pretty good. Yeah, pretty good. The one thing that had to drop was I was a track and field athlete, and as a 40-year-old, it wasn't happening as well as a 60-hour week. So that was the one thing that fell out of the equation.
Right. And when you said MSK, like you obviously had the choice to do MSK or sports first up, and given you're in Ascend, which is a sports specific rehab clinic, why did you go and do MSK?
Well, actually, the sports program wasn't running at that point, so the program had ended a couple of years before, and the first time they offered it again was 2014. So I did it because it was the only one available at Curtin. But there were things on the course that I really liked. So like I needed to get my clinical reasoning skills up and my assessment skills up, and it's a good course for that. So I felt like the manipulative part of that course that used to be called the manipulative masters is really the end product, the last semester, if you like. But leading into that, you get to use your hands properly and know what you're assessing and feeling, and know what you're doing treatment wise as well. And then the clinical reasoning skills for just more complex cases, and bringing in all the biopsychosocial stuff into that equation.
Yeah, and I think that's a bit of a hard thing with the musculoskeletal or the manipulative physiotherapy title, is that people straight away latch onto that sort of cracking the bone sort of concept. But as you say, there's a huge amount of underswelling of clinical reasoning and just palpatory skills and manual therapy assessment, and just putting all that together. And sure, like 10% of it you might manipulate or do a thrust or something like that. But I mean, I'm quite happy to mention now that I did all that, and I probably haven't manipulated a person's spine, in 20 years. So
I very rarely do it as well.
Yeah, but I still very much value the clinical reasoning, and I still very much value the anatomy, the path, the diagnosis, all those sorts of skills that you developed along the way.
Yeah.
But yeah, it's a shame we can't get a better word for the for the profession, because unfortunately that's what that leads people to think, particularly in the general public. Which leads us to the other bit we were talking before we went online, was that you then, decided you want to go back, and I guess the sports course was then offered, and you went back and did the clinical masters in sports as well.
I did. And so I think it just offers different things, the sports course. So I obviously went back and studied, and it wasn't that much extra work to do the sports, although because we were the first year doing it, it was they didn't really know how to pitch it, so there was probably too much work, to be honest. It was a little bit crazy at times. But it's just very different. So your clinical reasoning skills are a little bit different, probably less complex cases, but more sports focused. And probably more on the how to develop a rehab plan for an athlete from day dot to return to play. Being able to integrate that with a team of people, so a strength and conditioning coach, and using your other support team, your psych, dietitian, coaches, using technology, so getting au fait with using GPS and dynamometry and all that sort of stuff, and then looking at common sporting presentations as well. So quite a different skill set actually to musculoskeletal physio. So I know when I've done supervision of MSK students, they really have no idea how to get from a low-level physio-based rehab into end-stage rehab. Whereas the sports physio is integral to it. You have to know how to get people back to high-level sport.
Yeah, and I guess that, I think, to me, is the essential difference. Like we were speaking about, if you're an athlete's on the field and they go down with a back pain, do you send out the sports physio or do you send out the MSK physio? What would be your take on that?
I don't think it matters. I think those acute skills are probably something that both have, but it comes down to experience. I think we actually don't teach it very well in this country, the on-field stuff. So like in Canada, for instance, they do a degree of an athletic trainer or an athletic therapist, and their skills on field are vastly superior, I think, to most physios that we have here, unless you just have a lot of experience in being out on the field.
Okay, you've done your postgrads, you've done them through whilst working at a Descend, and then there's obviously comes a turning point because you decide to pick up sticks and stumps and head towards the land of ice hockey.
Yeah, exactly. So that was a life decision rather than a physio decision. So I married a Canadian, basically, and so the long-term plan was to try out living in Canada, and so I managed to talk to a really high-end sports med clinic, probably the best in Canada, best facilities I've ever seen. And so it just worked out perfectly, basically, that I was going to end up working there and moving to Vancouver. And then at the same time, the head physio role with the Canadian Women's Rugby team came up. So I ended up getting that as well. So I had a little bit of that on top of my clinical work.
And just for those that are interested in going to Canada, what's the story with regards to registration and working as a physio with Australian degree now?
Yeah, it was actually difficult. So I had to go back and do all of my basic registration skills. So I went and did a written exam, which was not that difficult, but just some extra learning. And I had to go back to my basic university days and go through all of my notes.
So we're talking cardio, neuro, geriatric.
Pediatrics, yeah. Multi-system, diabetes, everything that we went through and more.
So how much time did you put aside, and were you guided along that pathway?
Not really, but I wasn't that worried. I spent a week reading through all of my notes, and then I spent probably another week just going through past papers and going through questions and making sure it's multi-choice. So I was fairly confident with that. So I think that was 2015. And then I went across a couple of years later and did my practical exams.
So there's quite a big gap between your theory and your practical.
Yeah. And so that's just 16 stations, like OSCEs, basically. Not as high level as the ones within the closed curtain, but just stress environment. So you had 2 minutes to read a sheet of paper on the door, go into the room, do your 10-minute station, whatever that may be, teaching someone to walk out of a wheelchair in a Zimmer frame, answer questions on it, come out, go to your next room, 2-minute reading, 10-minute station. So 16 stations like that. So just a baptism of fire, basically, test of how good you are under stress, under pressure. And so the process was long and difficult, but it was just necessary to get my registration.
Yeah. So you're putting your hands up for anyone that's interested in moving to Canada to tutor them along the process?
Well, yeah, no, not really. But I think they've actually made it a little bit easier and probably will continue. They're having problems in Canada with getting their own physios registered because of COVID, basically. So they changed a couple of the things like the practical exams and the timeframes and all that sort of stuff. So it has changed a little bit since I was there.
It's always one thing that amazed me, because there you are, you're applying for it and being accepted into a high-end sports rehab clinic. You're going to work with a top-level sports team. Mm-hmm. Like, you don't need to know about Zimmer frames. You don't need to know about neuro and all that sort of stuff. And it's almost a shame we can't get like a limited registration. Someone says, as long as you work within your field of specialty, then we're happy to have you here, because you like me, I don't want to treat that sort of stuff now because I don't have the expertise, and that's not where I can deliver, best value. So it's kind of a shame you have to go back and do it.
Yeah, it is. Although I did have a couple of neuro patients, so it was nice to actually go through my neuro again.
Yeah. All right. So you got your registration. You've married your lovely wife, and you've moved to Canada. How did you go with the job in BC? And were you in Vancouver? Yes.
I was in Van, yeah. So Good. So the sports med clinic was brilliant. It was very musculoskeletal. It was set up like a team is here. So there were doctors on site, strength and conditioning coaches, psychs, hydrotherapist, physios, massage chiros, there were 150 staff basically. So huge clinic, marketing teams, all that sort of stuff. So really well set up, good programs, a lot of integration between staff. Very much a rehab based clinic. So people knew they were going to come in and have rehab. So less reliance on passive therapies, basically. And so, we could take them we had an underwater treadmill, and we could take them doing a hydrotherapy session. And we could get them running on an underwater treadmill. We had a BioMX suite, so we could get them on a force plate treadmill with Vicon system as well. So like all the toys, basically. We had rehab spaces outside, so you could go and do a field session with somebody on your own field.
Is this at University of BC? Is that sounds big enough?
It was a private, not-for-profit. So yeah, it was almost world leading. So Dublin have a very similar setup called the Sports Surgery Group. They just go one step further, and they do all the surgery in-house there as well. And then on top of that, I obviously had the rugby, so I would spend probably 6 to 10 weeks away every year with the national team, touring and international games, and then that suddenly all came to an end in 2020, and COVID had hit, and the clinic was almost too big, and basically was losing money at that point, and folded, so closed December 31st.
Wow, isn't it amazing?
Yeah. So that was what.
So all of a sudden, your dream, in that sense, I guess you proposed staying there for almost, long term.
Yeah, exactly. Yeah. And so all of the contacts that I have in Australia, I had none of that in Canada. So although I was working in like probably the best clinic in Canada, that doesn't give you contacts for where you're going to go next, basically. And so I'd looked around at jobs, and this great job came up with WACE. It was a brand new job with the swimming program, embedded within the program, so the ability to actually influence what you're doing. And it was part-time, 15 hours a week, but knew that I could get work here to top that up as well. So that brought me back.
Okay. So would you say that was like indicative of what happened to physiotherapy across Canada? Because it didn't really happen here. I know I'm in rural and remote, and it was kind of funny for a while, but basically it's been normal steaming ahead.
Well, we definitely went to a little bit more telehealth, but we probably had 3 months off completely, and then back into the clinic. So I think if it was just a physio clinic or a physio and rehab clinic, it would have been fine. But there was still a lot of things we couldn't do, and they were losing money. So for instance, like we had a 50-room hotel on site. And so a traveling team would bring all of their people, they'd use the catering, they'd use the sports hall or the fields. And so it was a one-stop shop, basically. And so after COVID, we didn't have any of that facility. We had no catering, no hotel. So we lost all that ability to have teams through there. So like, for instance, the Toronto Raptors would come and do their preseason camp for a week or 2 weeks prior to COVID. And they'd use everything, and so that's obviously a moneymaker. But as soon as you lose that revenue coming in, the physio clinic's not enough to support that.
Yeah, very much a unexpected consequence of COVID on that sort of business model. Then.
Yeah.
Okay, so you're back in WA. How's it? What's happening at WACE?
WACE is good. It's been really good. So elite swimming was new to me. I'd worked with a lot of swimmers, but high-end swimming is different. It's just a different sport almost. And so I'm there 15 hours a week, which is great. Worked with Brett Slocum when I first came back, so worked in his clinic, which was brilliant. Brett, me are quite similar age, quite similar philosophies, get on really well. He swimming physio and had been for a lot of years. So I learned a lot from him as well. And then after I'd been with him for 3 months, ended up getting a job with the Hockeyroos, the Australian women's hockey team, and spent all of last year doing 28 hours a week with them, so 0.7. So then had to leave the clinic, purely sports at that point, so swimming and hockey.
So at the moment, are you based in a clinic and then doing these, I guess, contract type jobs external to the clinic, or are you full-time with either waist swimming or Hockeyroos?
So Hockeyroos contract ended at the end of last year, so I'm now 15 hours with Wace, employed by Wace. And then I'm just about to start in another clinic in a couple of weeks, which is a really rehab-based clinic, for 15 hours as well. And then I'm just about to also start being physio for the National Artistic Swimming Program as well, that's based at Wace.
So is this, like, as a big broad brush comment, is this the way of a sports physio, that you move from contract to contract, or is that unsettling?
Yeah, it can be. Yeah. So depends on where you're at. So if you're embedded within a team, so for instance, I was at the West Coast Fever for 5 years, and you develop in that role, you get to learn your sport, and they want to keep you, and probably would have stayed if I wasn't moving to Canada. But
yeah, okay.
And Wace is I came on a 1-year contract knowing they would probably extend that, and so then they extended for another 2 years. That again will get extended for again, I'm sure next time, as long as you do a good job. But it is part of the sports physio realm, is you often are on contracts and you're relying on that contract being renewed or not.
Right. Now, this next question, I'm thinking of the younger physios listening to this and therefore ask the question: to become a sports physio, do you think that a person requires like a certain quality? And if so, what would that be, or what are they?
I think you've got to be prepared to work hard, because you're going to. When you go away with a sports team, you're generally the first up, because you've got to do something in the morning. You've generally got to do a triage clinic or a strapping before breakfast sometimes, or you've got to have your breakfast early so you can do it before training. You've got to be at training or competition all day, and then generally you've got to treat at night. So you're generally the first up and the last to bed. So it's not unusual to work 15-hour days, and so you've got to work hard. And I certainly have worked hard over different jobs I've had. When I first came out of uni, I had 3 different rugby teams I was looking after, so I was probably doing 20 hours a week on top of full-time clinic. And so I think you've got to be prepared for that. It's not something that it's just a 2-hour-a-week job. You've got to have a lot of resilience as well. It's a tough job. You're being questioned all the time, and you're going to get things wrong, and you're going to reflect on that, and it can be stressful. And so yeah, that resilience is really important, I think, and probably something that I only learned later on in my career. And you just got to be able to communicate well. So, because you're always going to be working in a team, you've got to work closely with your S&C coach in strength and conditioning, and you've got to work closely with your coach. So you've really got to have that clear communication.
Yeah. Okay. Now, another question that I sort of wanted to ask too, because this happens to a lot of physios. They travel overseas, they work overseas, and you've done that as well. You've come from overseas, you've gone back, and that sort of stuff. How has this influenced you as a physio, and also your career progression as a physio?
I think you gain things from watching how other places do it, for good or bad. And so it makes you embrace the things that you think you're already good at, and it helps you to learn the things that you're not good at. So sort of, if you think about some examples, we're really lucky here in that we can refer for imaging. We can look at imaging. We can integrate with the doctors on it. They don't have that in Canada, so it's very difficult to get imaging in Canada. So if you want an MRI for somebody, you're generally going to wait 3 months, and you can't refer for it. You've got to go through a doctor. So that helps you when you come back to Australia actually to use and embrace that. But I think other countries also do things well. So like when I was in Canada, I think they do concussion pretty well over there. They have some really strong research there. And so that made me upskill quite a lot. And I think as well, just that rehab component was massive for me. So in the clinic, I know we had an Aussie guy who lived in Canada before and then moved to Hong Kong. He was a pilot, basically. Had a really bad motorbike accident, and so came back to Canada to do his rehab. And so I was able to see him every day for 2 months, basically. And so rehab every day for 2 months, and it makes you appreciate how good you can be with rehab when you have a regular access to that. And so it wasn't unusual for me to see someone twice a week or 3 times a week, and not for hands-on, but for actually going through their rehab programs. And so again, that's something that I think that I bring back to Australia now.
And you get to see the influence of that, don't you? Like,
yeah, you do.
I worked and lived in Canada too, and worked at quite a few different clinics and got to see even how individual practitioners interacted with the system and had a look at the results of it. And one of the other big clinics when I was there with Dib and Bill Trelaw on Broadway. Yeah. And it was interesting, like Bill's very much a 5 to 10 minute appointment. Deb's very much a 30 to 40 minute appointment. And when you do a locum for one and then next week you're doing a locum for the next one, it really was chalk and cheese as to how their particular demographic of clients expected you to treat them. And that just really opened my eyes to, you can have 2 physios that have very completely different approaches to management, but they still build a demographic of patients around them that's what they want, and that's successful for them. So
yeah, well, and I think the thing that I learned I wasn't good at when I first arrived there is working out with the patient what they want and need. So are they looking for to be given a program they can go away and do themselves, or do they want guidance on that, or are they expecting none of that and they're expecting you to fix them and hands-on? So I think working out what your patient actually wants and needs is something that I've really taken away, and I still use here now.
Yeah, I think that's a really important point for all of us to continue to remind ourselves, because there's no point giving something to somebody that doesn't want it.
No, exactly.
And conversely, there's no point not achieving what a person wants from us, because they won't come back either. So both are missing the mark. Hey, look, while we're talking on potential failures, what would you sort of say is the hardest lesson you've learned so far as a physio?
Oh, that's a great question. I think just making sure that you're on the same page, particularly in a sports team with other people in the team. So, not taking for granted what you think a coach wants or an S&C wants. It's actually using that good communication. Because it can break down, it can break down quickly as well. And it's hard to fix that once it happens.
Just as a lead on from that, where's the priority lie? Is it with the client or the athlete, or is it with the S&C coach, or is it with the head coach, or is it with the owner of the team?
I think we always have to advocate for the athlete as a person. And there can be some context around that in terms of the coach. So, for instance, what's the importance of them being able to train or play at this point? Is it pre-season? Is it season? Is it a final? And so in the back of your mind, though, you've got to think about what's the safety for your athlete or play as a person.
And when you're going into politics.
Yeah, exactly. Yeah. My next career.
What's that?
That's my next career.
Yeah, well, I have no doubt. For $200 or less, what's the best book or app or tool or investment that you've made in yourself as far as clinical development and physio?
Well, $200 isn't a lot. Doesn't really get you a lot these days. There was a really good app that I probably used to use every day, which is, I think it's called Essential Anatomy, and it was probably $60, something like that. But it was great for explaining to patients, athletes about what's going on. You can put muscles up and down and connective tissue and all that sort of stuff. So it gets them to visualize things, which was great. The other thing that I really liked was I bought myself just a little handheld dynamometer, which was probably a bit more expensive than that, but maybe 400. But again, just to get some objective measures for things.
Okay. Good tips. Good tips. What would you say has been the most out on a limb decision that you've made in regards to your career, and what was the outcome of that decision?
I would say probably, so when I first graduated in 2010, I'd worked in rugby since 2007. So I'd done 3 and a bit years. I'd already been, basically the sports physio that I worked with at my club left the year before. He was a big influence on me, was one of my early mentors, Marty Meyer. And so he left the club. And so I ended up being the head physio at the club for a year, like not even graduated at that point. So head trainer, if you like. And so when I left university, there was a job came up at the Western Forces as an assistant physio. So like looking back, I was completely underqualified for it, but went for it anyway. Had some confidence in my own skills. I don't think arrogance, but I knew I was underdone a little bit, but applied anyway. Rob Naish was the head physio, and rightly so, didn't get the job. But Rob was really great about it, and he was like, this is where you're lacking. You need to build up this, and this, and I think we can probably help you with that. And so brought me in as a sort of part-time physio, basically, and helped them with their screening. Did some treatment work with them, and so just upskilled me basically. So Naish was a big influence, and I think if I hadn't applied for that job, would never have got into that realm.
Yeah, and then also that just gave you another contact, and as you say, there's nothing better than positive feedback negative feedback that's followed up by how we can rectify those problems too.
Definitely.
Yeah.
I think the other thing that influenced me, probably so I was a student rep on the physio committee, so the sports physio committee and also the dry needling committee. As you know, we work together. And so just the committee work was brilliant because it just opens up doors to you, and you get to meet experienced clinicians. And it's how I got my job at Ascend. So convened a course that Ali Lowe was running, and she was the boss at Ascend, and helped get me the job there. And then I obviously worked with you on the dry needling committee, and ended up a couple of years later being the chair of the national group. So, and again, you meet these amazing practitioners who are experts in the field, and you get to hang out with them. So
yeah, it's, as you say, it's a great way to network too, isn't it? Like, you might not be on the same clinical basis, but that doesn't mean your enthusiasm, energy, and capacity can't be, assisting, and then you get to know these people. And it's all about, knowing people. And if they know you're, a good person, you're committed, and then they sort of think, well, that would be a nice person to work with as well.
Yeah.
It's a lot better than a job interview, cold turkey sort of style.
Absolutely.
Hey, looking overall through your career so far, what would you say are 3 highlights for you?
Working with national teams has been like my, it's probably something I've been most proud of. So Canadian Women's Rugby team. I did some work with the Canadian netball team as well. And then hockey race, so Australian women's hockey. I've just come back from the World Championships working with the Australian swim team, which was great. My first time working with the Dolphins. And then again, just about to start working with the artistic swimming program nationally. So that's obviously it's a big highlight for me is getting those teams under my belt. And then I think last year with the hockey was a good year. We had 2 months away, did the World Cup, and then straight into the Commonwealth Games. And again, that was probably a highlight for me, was, going through a whole World Cup, winning a bronze medal, heading off to the Commonwealth Games, being an paid physio within the Australian team. Again, winning a medal, winning silver medal. So that was a proud moment. And then I think just looking back at the journey and, knowing that the hard work that I put in the first place actually has got me to a good point.
Yeah. And whilst you're in a reflective mood, like if you would go back to yourself when you're sort of 37, 38, you're just starting out in your physio career, is there anything that you'd like to, I don't know, say to yourself or pass on to yourself at that point now that you know what you do know?
I would just say, like, all the hard work pays off. So, I was working really long hours in stressful jobs, and you don't want to go out on a Monday night and do a sports job just because it comes up, but like all of that hard work really pays off. So I think just clarification, really, that you're doing the right thing. So yeah, keep at it, basically. Don't be put off. And I think just learn as much as you can, take it all in.
And looking forward, like there's a bit of a discussion going on in our profession at the moment. Where is it you would see physiotherapy going in the next 3 or 4 or 5 years?
I think what I'm seeing at the moment is there's a little bit of a push away from manual therapy and into rehab or whatever that looks like. And so some physios won't touch a person because not sexy anymore to do manual therapy, but it is to do exercise therapy. And I'm not sure I really fall into that camp. So although most of what I do is rehab based, I think there's still a need for hands-on. So I am a manual therapist and I do needle a lot, and I see good results personally from that, even if it gives me a window. And I think we need to settle the balance somewhere. And so at the moment, that swing of the pendulum is really towards exercise and away from manual. I think we need to swing back a little bit and get a bit of a balanced view.
Well, being a person that's trained in both, higher education, trained in both MUSC and sports, that's a pretty valid perspective, because some of us are just MUSC and some of us, I guess, just sports. But yeah, is there anything else you want to say about that swing of the pendulum or the balance that you see in how you'd apply it clinically?
I think just there are obviously some people that are quite high profile that are pushing towards the rehab. And so it can be hard to resist that as a young physio. Adam Meekins is one of those people that is quite high profile and definitely pushes towards, don't do manual therapy, don't do hands-on. It's not useful. But I think use your skills that you learn at university, and you can use those skills and you retest. So does someone get better from hands-on or from needles or whatever that may be? So use your own, it's part of your clinical reasoning. So
yeah, okay. And like just generally for yourself, like you would have to have had the most condensed, concentrated process or physiotherapy professional development that I've come across in like 30 years. Where do you see Chris Perrey heading in the next 5 years? Like, how condensed are you going to continue this progression?
Who knows? I've still got goals, so I still want to do an Olympics or 2. So that's my first goal. I really want to do a Rugby World Cup. So the plan was always to do the Women's Rugby World Cup with the Canadian women's team, and the World Cup ended up getting postponed by a year because of COVID. So I missed it. So I left Canada and came back to Australia, and so was a year away from the World Cup, basically. So I still want to tick that off as well. I want to do a Women's World Cup with whatever team that is. Yeah, and I'd like to go through another period of just doing some sports. Like I love the private practice stuff. It's different, and you get to see people can change quite dramatically in their lives. But I would like to get back into some pure sports as well, I think.
Cool. And are you back running again as well, Chris?
I'm just keeping fit now, really. Ticking along, running, biking, swimming, gymming.
Cool. Well, look, thank you so much for your insights, both,
Pleasure.
on the mask and the sports, and also how fast a person with goals can progress their career, even if they start late in life. Because I think that, hats off, that's an amazing progression you've gone through. And I guess, well, only 15 years really, isn't it? So you've really consolidated and moved quite quickly, both locally and internationally. So thanks for giving us your story. I'm sure there's some people going to listen to this and actually find quite some amazing insights to it. And wish you all the best to get to that World Cup and also the next Olympics.
Great. Thanks, Doug. Good to chat to you.
Yeah, all the best.
All right. Bye.
Thanks so much for listening to this episode of Physio+10, in which I trust you gained some valuable insights. It'd be awesome if you could leave your 2 cents worth as a review or rating of this podcast, and I look forward to sharing the story of another trailblazing physiotherapist with you in 2 weeks' time. Stay safe. Bye for now.